At this time of the pandemic and lockdown, the Social Development Research Center has embarked on a mental health related project. On behalf of the team, I would like to share updates on our project entitled Development and Pilot Testing of Remote Counseling for Victims and Survivors of Online Sexual Abuse and Exploitation of Children, or simply called OSAEC. This SDRC project is supported by the Asia Foundation and Safer Kids PH, which is a consortium of three organizations that advocate child protection, namely UNICEF, Save the Children, and the Asia Foundation. This project is indeed timely and relevant. And one interesting note about this project is that we will be using the platform that was used for abuse in the context of healing and intervention. This is a two-phase project. The first one was completed last year, where we did interview and desk review. In that particular phase, we found out what are the psychosocial and emotional needs of OSAIC survivors and victims. We also adopted a framework. One particular outcome of that project is the protocol process flow, which describes the process of remote counseling from the inquiry phase down to the implementation of remote counseling. The second phase started in April, and this involves development of treatment manual and pilot testing of 30 OSAEC survivors. At this point in time, we have trained remote counselors, telehealth coordinator who will be implementing the program. The second phase will involve using the model or the framework that we use, and it will address three main goals, primarily regulational capacity, relational capacity, sense of self, and future orientation. In the treatment manual, all participants will undergo the same process, starting from the interview of their parents and guardian and the 6 sessions of remote counseling, and finally, at the end, feedback giving to parents and guardians as well. Throughout this particular study from phase 1 and phase 2, we are mindful of the ethical issues in the conduct of research on children and also doing remote counseling and telepsychology. Hoping that at the end of this particular project, we will find out how feasible remote counseling is for OSAIC survivors and victims. We are hoping that this particular project will inspire and motivate others as well to do similar applied research on mental health related topics, particularly on vulnerable population. So thank you very much for the opportunity to be able to share our research project, and we are grateful to SDRC and the Asia Foundation. Thank you so much.